I was diagnosed with breast cancer in December 2000, and they did the testing for her too at that time in Germany, or some hospitals did, but there wasn't any treatment at that time. So it was quite an aggressive tumor I had. So I had surgery, certainly, and even though there were no lymph nodes involved, I did a chemotherapy because my doctor said it's better because it's so aggressive. And afterwards I did 7.5 years of anti-hormonal therapy. That's because I couldn't get the trastuzumab at that time. And even though it was a long way, I mean, anti-hormonal therapy, I think, is worse than chemotherapy. For me, it was. The other one was a certain number of months, and then it's over. But to do it for 5 years or 7.5, and now we're talking for some patients about 10 years of anti-hormonal therapy. So that's my own story. I was always very supported by my family, my husband and my sons, which really helped. During the chemotherapy, I learned from other women that they hardly got any information in the beginning, that doctors didn't explain exactly what it means to have breast cancer and what the treatments, what the advantages of the treatments are, how much the risk of recurrence could be reduced. So they hardly knew anything about it. And I also learned that many relatives or families step back and don't support the person, the woman. So at that time I thought, oh, look how much information you can get in Germany. And I found out there was very little. So that's why I founded the German Breast Cancer Association, together with doctors and other people that are somehow working in the breast cancer field. And our main focus was to provide as much information by different means for patients, for relatives, but also for doctors, for physicians, how to communicate with patients better. And so we provided a lot of material we could send to patient, and me being a medical journalist, I was able to write everything. And we started to do video interviews on all big conferences worldwide, which are for the patients and for the doctors, and at ASCO and San Antonio, the two big conferences. We also do a roundtable at the end where the physicians wrap up all the news of trials or whatever there were during the conference. So that's how it started with the German Breast Cancer Association.